IgA vasculitis, also called Henoch-Schönlein purpura, is a condition where small blood vessels, tiny tubes that carry blood, become inflamed. The inflammation is caused by a substance called IgA, a type of antibody that normally helps fight infections. The disease most often appears in children, but adults can get it too. Think of the blood vessels as garden hoses. When they get clogged or irritated, the water blood can leak out, causing a rash and other problems. The exact trigger is not always known, but several things can set off IgA vasculitis. Recent infections such as a cold, strep throat, or gastrointestinal bugs. Certain medicines, for example antibiotics, or vaccinations. Rarely insect bites or allergic reactions. Imagine a child who just recovered from a sore throat. The immune system is still on high alert, and the extra IgA may spill into the walls of small vessels, starting the inflammation. Common signs and symptoms include a raised purple rash that looks like tiny bruises, usually on the legs and buttocks. Joint pain or swelling, especially in knees and ankles, making it hard to walk. Stomach pain, vomiting, or blood in the stool, because the gut lining can be inflamed. Kidney involvement that may cause dark urine. You can picture the rash as a playground sandbox where many small red marbles blood have popped out onto the surface. Doctors diagnose IgA vasculitis by looking at the rash and asking about recent infections or medicines. Doing a urine test to check for blood or protein, kidney check. Occasionally taking a tiny skin sample, biopsy, to see IgA deposits under a microscope. Treatment focuses on relief. Rest and plenty of fluids. Pain relievers such as acetaminophen or ibuprofen for joint pain. If kidneys are affected, a doctor may prescribe steroids or other immune-modulating drugs. A simple example, a child with a rash and sore knees may be given a short course of ibuprofen and told to stay home from school until the rash fades. There is no guaranteed way to prevent IgA vasculitis because the trigger is often an infection we cannot fully control. However, general health habits can lower risk. Wash hands often to reduce respiratory and gut infections. Keep vaccinations up to date. They protect against many illnesses that could start the cascade. If a child takes a new medication, watch closely for any rash or joint pain and tell the doctor right away. Think of it like maintaining a clean kitchen. The fewer germs you let in, the less likely they are to cause a mess later. Recent research highlights new blood tests that measure IgA levels more accurately, helping doctors diagnose faster. Studies on the role of gut bacteria, the microbiome, suggest that a balanced diet with probiotics might reduce the severity of the disease. Trials of newer, targeted drugs like rituximab for patients whose kidneys are badly affected, showing promising results with fewer side effects than high-dose steroids. These advances are like upgrading from a basic flashlight to a LED lamp. They give doctors brighter, clearer tools to see what is happening inside the body.